এইভাবে পড়া হয়েছিল, এর মধ্যে কিছুটা বেয়ে গেছিল, বাহাবার পর এইখানে কিছুটা থেকে গেল।
This patient has a classical history of a sarcoma. The patient had this tumor for the last 7 years. It was a huge mass. It was a mass of maybe about 50 cross 40 centimeters.
বোম্মা সাহেব আর বিশাল সাহেব, হ্যাঁ ভালো হয়েছে, হ্যাঁ হাঁটতে পারছি, হ্যাঁ দেখা হয়েছে, না ব্যথা নাই, না।
ইনি আমার কাকু হবেন। ইনার আগে একটা পায়ে টিউমার ছিল, তার জন্য আমরা হোপেন হিল হসপিটালে আসি। আর যে অপারেশনটা ডাক্তার বিশাল মুখার্জি এবং ডাক্তার ব্রহ্মানন্দ স্যার করেছেন, তাদেরকে অনেক অনেক ধন্যবাদ যে অপারেশন সাকসেসফুল হয়েছে। সঙ্গে হসপিটাল স্টাফ অথরিটিকেও ধন্যবাদ জানাচ্ছি আমরা সুস্থভাবে পরিষেবা দেওয়ার জন্য। যে টিউমার অপারেশন করে বের করা হয়েছে সেটার ওজন প্রায় 12 কেজি 500 গ্রামের মতো হবে। উনি এখন সুস্থ, হাঁটা চলাফেরা করতে পারছেন।
Hello, I am Dr. Vishal Mukherjee, consultant surgical oncologist at Open Hill Cancer Hospital.
Hello, myself Dr. Brahmanand A. Bhangargi, consultant surgical oncologist at Hope and Hill Cancer Hospital.
So basically this patient came to us through a tumor board. We were called in a tumor board to look after this patient. And what we saw that this patient has a classical history of a sarcoma. The patient had this tumor for the last 7 years, which was usually very, very slow growing. But for the last 2 months, he had a history of a rapid increase in growth, followed by a pain over the right thigh. It was a huge mass. It was a mass of maybe about 50 cross 40 centimeters. In the tumor board with the radiation team and our medical oncology team, we examined the patient. And the first thing which struck was that the distal part of the leg had no edema, had no atrophy of the muscles. The first thing which struck was perhaps the arterial and the venous system of the legs were free. So we went for a local staging with an MRI and as well as a systemic staging. Decided that perhaps this patient, after looking for the local staging, may land up in a wide local excision.
Before we decided to embark on surgery, a proper detailed evaluation of a right thigh was done. A proper MRI of the right thigh was studied, and we decided, we have pre-operatively we have optimized this patient. We decided to embark on a surgery, and during surgery, first and foremost, we divided the compartments in compartments. Then we tried to palpate the femoral vessels. We tried to secure the femoral vessels, and once we secured the femoral vessels, we have removed en masse around 12.5 kg of a tumor from the right thigh, and followed by that we have done an aesthetic closure of the wound, following which we have started a rehabilitative process for the patient on post-operative day 2, and we started the patient started to walk along with the ambulatory support. Followed by that, we have discharged the patient.
The biopsy report is still pending. It was one of those cases where we step ahead in our journey towards cancer excellence, and it was one of those cases where we really have to push ourselves to get a clear margin and proper closure of this patient. The biopsy reports are pending. Hopefully everything will come within few days. Thank you.
Thank you.